welcome to Postpartum Years Podcast. I'm your host, Dr. Mary Ellen Cramp. I am a physical therapist and a pelvic health specialist. Joining me today is Bev, and Bev has had a couple of pregnancies and a couple of postpartum journeys. Welcome, Bev.
Thank you.
So, Bev, let's start with one of the pregnancies. You can start with the first or whichever one you'd like to start with, and tell me your stories.
I will start with number one. I was younger. I guess a little bit younger. I was 28 years old, 27 when I got pregnant, was married and was teaching. I think I'd been teaching for a few years at that point, and pregnancy was fine. Everything was good and normal. And, I was going to an OB on a regular basis, and my OB was like, well, sometimes first pregnancies, they go longer than they should. So if you get to more than 40 weeks, we'll schedule you for induction. And I was like, okay, well, that's not going to happen to me. My baby's going to come naturally. I won't need induction. And, at the end of those, I think I was about 38 weeks, I decided, teaching is a lot. I really want to have some time to prepare my house and have some relaxation before the baby comes. And I know she's going to come on time, if not early. So I actually took the last week of pregnancy off. And I was like, let's prepare all the things in the home and relax myself a bit. And of course, she never came. She didn't come early. And I didn't know any of the techniques. Like I didn't know all the things that I could try to do to, try and move things along faster. And, I had to, what'd you say?
They don't work. So don't worry about that.
Well,
they work. They might have worked for somebody, or if somebody had like those dates, like the week before they went into labor.
They don't work. Well, I didn't do anything and ended up having to be induced. And honestly, I wish that I had waited longer, but they were saying that because of the way I was measuring, that they were expecting a large baby. They were expecting a 9 or possibly 10-pound baby because of my measurements. I'm not sure whether, I'm not sure how valid the measurements are, but, I was scared and said, okay, sure, let's do the induction. At least I'll know when she'll be born and, I can prepare in advance. And so I went into the hospital night before, did the Cervidil and all the preparation for the induction. And the next morning they started Pitocin, and I don't know what I was thinking. I don't know why I thought I could handle that amount of pain.
Because you don't know.
You don't know until you do it. Exactly. And it was excruciating. The induction pain was the most severe pain I have ever felt. I then said, give me some drugs, please. And I got oral drugs. I don't recall exactly what it was, but I remember feeling out of it, feeling like I was loopy, like I was drugged essentially. And then once that wore off, asked for an epidural, got the epidural done. And it was a lot better. Epidurals are amazing. It was great. The epidural did start to wear off toward the time where I felt I could feel things. I could feel the pressure to know that it was time to push. So I was thankful that it was starting to wear off. It wasn't a continuous drip epidural or, I don't know if the hospital did things differently than hospitals do now. So I could feel things. And I was thankful that I was able to feel things because then I knew like my body could feel when I was having the contractions to be able to push. I hear stories about women pushing for hours when they've had an epidural. And thankfully it was maybe 20, 25 minutes and she was out because I could feel it. I was thankful for that. And she was out. Then I felt enormous relief. She was out. I was happy. And all of a sudden there was chaos and lots of people came running into the room and the doctor was like, oh, I need this. I need that. I need this. And initially there were 3 people in the room: doctor, nurse, husband. That was it. And next thing I know, I look up and there were 8, 10 other people in the room. Apparently, I was bleeding a lot and I didn't even realize that it was happening to me. And I ended up getting like I'm not sure what the shots were in my legs. And eventually the bleeding stopped. But afterwards, my husband was like, I've never seen so much blood in my whole life. I thought you were going to die. Of course, thankfully, I did not. And I felt fine. I felt a little cold afterwards, but they gave me a warm blanket. I felt okay. I did tear as she was being born. She was 8 pounds, 9 ounces. So she was a big baby. And I tore, so I was being stitched up. And while I was being stitched, I was flinching, and the doctor was like, "Wait, you could feel this? I thought you had an epidural." She didn't realize that I could feel it. And I was like, "No, I can feel it." So I got some local anesthesia and then was stitched up. Going home, things were okay. I struggled a lot with breastfeeding. It was my goal to breastfeed. It was in my head like breastfeeding is best. Breastfeeding, like I'm a science teacher. I know the benefits of breastfeeding and having the antibodies. And I, I know that I think that it's best. Fed is best, but breastfeeding, I think, is better than formula feeding if you can breastfeed. And I was distraught with the amount of crying that my child was doing, my inability to feed her adequately. It was hard. My mom came to visit and she was just very much like, give her some formula. What are you doing? Just give her the formula. Just instead of trying to encourage me to go to a lactation consultant, or she was just like, give her formula. What are you doing? Just stop breastfeeding and give her formula. And I felt like it was very counteractive to what I was trying to do. Thankfully, my husband was very supportive and he helped me look up some lactation consultants in the area. And we went to a lactation consultant and without my mom. And thankfully, she was like, if this is what you want to do, I will help you do it. And I rented a hospital grade pump, started pumping between feeding sessions, and did a supplemental feeding system with like a tube attached to my breast so that she could get formula or breast milk that I had pumped while also feeding from my breast. And that really helped.
Got
And
it.
within 2 weeks, my milk was in. She was
Good.
feeding. It was just amazing. Thank goodness I went to that lactation consultant.
Yeah.
And it was just great. And for the first, from 2 weeks to 3 months, things were pretty good. Then I started having vision problems where my like double vision. I was seeing things not blurry, but I was seeing two of objects, and it was getting increasingly worse to the point where when I was driving, sometimes would have to close one eye so I could see things in single vision. So I went to an ophthalmologist, or like Vision Works or my eye doctor, someplace like that. And the ophthalmologist was like, "Ooh, oh my goodness, your optic nerves are swollen. I'm going to need to
Ooh.
send you to an ophthalmologist." So I went to an ophthalmologist. The ophthalmologist was like, "Ooh, I don't think I can handle this. I'm going to send you
Neurology.
to a neuropathic, and yeah, neuro-ophthalmologist." So I went to Sinai Hospital. I was living in Baltimore then. Went to Sinai Hospital and they were like, "Oh my goodness, that's really swollen." And called all these students in to look at my eyes because I felt like a spectacle, like
Uh-huh.
a circus freak, that something was wrong with my eyes. And they said, "Well, let's do a spinal tap, see what's going on, because there's definitely something going on
You
with
should
your
not
eyes.
have
And
pressure there.
otherwise,
Mm-hmm.
everything else was fine." So they did the spinal. I went to the hospital, did the spinal tap, and they did an analysis of my cerebrospinal fluid and found foreign bodies. They said they weren't sure what it was. It wasn't, I did not test positive for meningitis, but there was something that was there that shouldn't be in my cerebrospinal fluid, was not draining properly and putting pressure on my cerebrospinal fluid. And the increased amount of fluid was what was putting pressure on the back of my eyes that was,
Mm-hmm.
making my optic nerve swollen and affecting my vision.
Yep.
Oh, I was quarantined in the hospital. They said they were just going to give me antibiotics in the hospital. No one can come see me for 3 days. Unless my husband did come see me once, and he was gowned
Gowned.
up,
Mm-hmm.
mask and gown and glove and completely fully. It was a very scary experience. But after the course of antibiotics, I was allowed to go home, but needed medication to reduce the amount of fluid. And because of that, couldn't breastfeed anymore. I was quite upset that I had done all that work and struggle to be able to breastfeed, to then find out that I would not be able to breastfeed. So she went to formula feeding, which is fine. She's a healthy 16-year-old now, but I was upset about not being able to do that. She did get a little bit of frozen milk for a while, but the formula was best for her because my milk was medicated. Eventually, the problem dissipated. I'm no longer taking the medication and I'm fine now. But at that point, I was like, how did something get into my cerebrospinal fluid? Maybe, like, how would that have gotten in there? Maybe it was the epidural. Now, you're a doctor. You know, I don't know whether or not it came from the epidural itself. But after that, I was like, I'm not ever going to have an epidural again. Was my no. I just said no. So postpartum after that was okay. I did have a little bit of incontinence when I coughed or sneezed, just a little, not anything that I thought wouldn't go away with like Kegels or,
Mm-hmm.
some exercise. And it did get better. 6 months, a year or so later, it was better. I feel like that was first birth.
Alrighty, what was the second one
That
like?
was a lot. Sorry.
No, no. I mean, that's, you know,
Yeah.
your experience is your
So
experience.
second birth was a couple years later. I got pregnant about 2 years later. My husband and I weren't necessarily doing so well in our marriage. We were struggling a bit and we're going to marriage counseling. And, if we are going to get divorced, I do like it happens. I know that divorce happens. But if we could have another child also, I feel like they could be a support system for the other if we are divorced. He didn't agree, but he thought that we would work through it and we would stay together. So we tried again and ended up getting pregnant with a boy. And this time I was like, I am not going to take off work early. I wasted precious leave time. And teachers, contrary to what most people believe, we do not get paid maternity leave. So I wasted precious maternity leave with the first child, staying home for no reason without my baby. So this time I was like, I'm saving up all my leave. I'm working till the day he's born, and I did. I remember being at work in the hallway doing hallway duty, and teachers saying, "Oh my goodness, you're still here. When are you due?" And I was like, I was due last week. And they're like, "What?" I'm like, "Yep, I'm going to be here till baby comes." And I was. I mean, I went into labor at 40 plus 5, so 40 days and 5 weeks. And I had worked the day before, and middle of the night, I started having contractions. And everything in that pregnancy had been healthy. No gestational diabetes, no high blood pressure. I was a pretty healthy woman. I was, outside cutting grass and doing yard work and trying to keep active and trying to help him come early so I wouldn't have to be induced again. I did curb walking and all kinds of things in attempts to get him to come out early. He did not. He waited till 40 plus 5 contractions in the middle of the night. I labored through the night and then waited till the morning to make sure that I was actually in labor before going to the hospital. But I went to the OB's office first to make sure. And the OB was like, "Yep, you're about 2 centimeters dilated. I think you should go to the hospital." So went to the hospital and labored there for a while. My water still hadn't broken. So they broke my water that afternoon, labored some more. It didn't seem to be progressing fast enough. My OB, the OB on call, had been there all day, came in and basically was like, "Well, you have two options at this point. You can either Pitocin or go home." And it was just like, "I don't want to go home. I'm definitely in labor." He's like, "Well, you can go home and come back when you're further along, or you can get Pitocin." And now I feel like I was pressured into getting the Pitocin. And I wish that I had gone because, oh boy, the Pitocin contractions started. And it was just like I was being induced again. It was the most horrible pain. And I had tried to prepare myself for this pain, and I had done have you heard of hypno
Mm-hmm.
babies? So I did all the hypno babies techniques, and I had been practicing for months before birth with the hypno babies techniques, and I was doing well up until the Pitocin hit. And once that Pitocin started, I was like, "It's okay. This is what my body was made for." I was doing the mantra and listening to the Hypno Baby CD and trying to make it through. And then I got to a point where I was like, "No, I can't do this. I need an epidural." So they called the anesthesiologist, brought the anesthesiologist in. And as the anesthesiologist was wiping my back with the iodine or betadine, I was like, "Right now." And everyone was like, "What?" And I was like, "Right now. Don't stay." And I just laid back and I was like, "I'm going to push. He's coming out right now." So I made it through without the epidural,
Good
thankfully.
for
Yeah.
you.
He came out. Everything was great. Um, no issues after birth. I still got charged for that epidural. But it's okay. Like they said, because I even called the insurance company afterwards and I was like, I don't know that I should have been charged for this. I didn't actually have the epidural. But the hospital had said, since they had prepared everything and it, regardless, baby was healthy, 7 pounds, 4 ounces, perfectly healthy baby boy, no issues after birth physically, besides the same incontinence. And things seem to be going well. Having two is a lot different than having one. Having a toddler and a newborn
Mm-hmm.
was so challenging. My husband went back to work and I was home on maternity leave. We had timed it so that he was born in May, so that my maternity leave just went into summer when I was off from teaching. But I was struggling with my mental health, struggling with just finding moments of joy. I just felt overwhelmed with stress of having to take care of these little people and crying and whining and the daily tasks of laundry and cooking and cleaning. And it was just a lot. And I decided that I needed to go see a therapist. So I went to the therapist, went to one first, and realized quickly that that was not for me. And a recommendation from a coworker who, had gone through a similar experience and went to a new therapist, and it was like a glove on my hand. She was
Perfect.
amazing and helped me through everything and suggested medication. And I went to my primary care physician and got medication for depression and something that was a low enough dose that I could still continue breastfeeding because breastfeeding was great. And I had oversupply. Like it was just everything else was great. So I just didn't understand why I was so sad when everything was supposed to be so great. And
Hormones.
thankfully the medication helped and I felt better, and I ended up seeing that counselor, that therapist for 4 years just because I thought he really helped a lot with my mental health. And
Good.
I would probably still be seeing her if I still lived in that area. Things were pretty good after the second. I was 31 when I had him. My marriage did not last. We had issues with fidelity on his part and drug use on his part. So there was a lot going on with us. I'm glad that I was seeing that therapist, and then I also went to a marriage counselor, and he went to rehab, and there was a lot going on. But we ended up getting divorced, and so I found myself with a 3-year-old and 1-year-old, 3.5-year-old and 1-year-old by myself most of the time. But I made it through. The therapy definitely helped. I feel like the postpartum experience between my second and first was a lot different. Breastfeeding issues first time, mental health issues definitely the second time. Powered through and was able to get myself to a better state mentally.
Bev has some very interesting stories. We've covered 2 of them so far, so we're going to pause right here because the third one gets even more interesting. So we shall see you next time on the Postpartum Years podcast. Bye.